Hi, folks. Steve Urban here, founder and CEO at Riderflex. We hope you enjoy today's podcast. And as a reminder, please subscribe to the Riderflex show for updates on new episodes. And by the way, if you haven't already, check out the book we recently launched, The Riderflex Guide, Inspiring and Hiring, available for purchase on Amazon. And now, a quick word from our sponsor.
Try the #1 marketing platform for small business. Everything you need from design to marketing to CRM. Learn more at marketing360.com. Marketing 360. Fuel your brand.
Anyway, Cindy Jordan on the Riderflex podcast. Good morning, Cindy.
Good morning, Steve.
Are you in Arizona?
I am.
Okay.
I live in Tucson, and it is a wonderful time of year, except for like today, in the morning it was 29. And so that's very, very unusual, but we'll get up into the mid 60s. That's what's kind of great about the desert. It always has that dramatic swing.
Yes. I've been to Tucson many times. I know that area pretty well. Looked at some property down there at one point. What was the name of it? It was east of Tucson. Oh, wait. No, north. Oh, shit, I can't remember. But anyway, east of Tucson somewhere. One of those small little desert towns where you could still grab something, at a fairly decent price that wasn't, overpriced yet. Kind of looked around, but my wife she's like, no.
Well, that is the discussion right there.
But Tucson's cool. How'd you get there?
I've had a really eclectic career, but I pretty much lived and grew up my whole life on the East Coast and settled in the DC area when I was in middle school. And so my first job out of college, I was actually a police officer in the DC area. And
cool.
I have a lot to say about that job.
Wow, that's a whole episode. We could do like a whole episode just on that.
You really could. Paramilitary is not my thing. It was, but what I learned, at 21, driving around in a cruiser and carrying a gun was that I learned a lot about emotional intelligence, right? Like my entire existence was to de-escalate and like get to the sort of the core of where it's supposed to be and move on, because I certainly didn't want to get into any kind of altercation out there. So I did that for like 5 years and then started leveraging my degree in politics. My degree was in government. Yeah. And did some fundraising and loved that. But worked on a presidential campaign, and then really, we ended up, the candidate I was working, to help support lost. And so I was like, I'm kind of done with the DC scene. It's crazy how much politics is at the center of everything that goes on there.
No doubt about it. Yeah. I spent 3 years working in DC. Yeah. People that have not experienced that. Yeah. I mean, the entire town evolves around that. Yes.
Yeah. It's the heartbeat of that town. And yes. I had been here to Tucson to do a few fundraisers and loved it, loved the desert, loved the fact that you could drive down the freeway and see the horizon. Cause in the East Coast, it's all like 95 is all trees. And so just really without even a job, just sort of picked up and moved here and
really?
Wow. Just started building a life here and fell in love with it, really.
What'd you do for a living when you went out there? When you started applying for jobs, or what you're like, okay, I guess I'll find something.
Well, I worked for a nonprofit here for a little bit, and then this is really kind of the pivotal point in my life, which drove me to entrepreneurship. I got picked up by a marketing firm here in town that was run by these two like awesome women. And it was the first time I was in a job where where someone actually said, hey, you're super smart and good at this. Cause what I was good at was like sort of taking numbers and turning them into messaging that worked. And so I became the lead strategist at that firm. And also the other lesson I learned at that firm was that you could actually be authentic and have a good culture where people want to come to work. It was the first job where I was like, man, I love this place.
Yeah, cool.
But then the crash in 2008 happened, and everybody knows that every marketing firm in the world got crushed. And I guess maybe 4 days after all the layoffs that we did, I went to the two women that own the firm. I'm like, guys, here's what we're going to do. We're going to start a company right now. And I've been having this idea and I've been percolating on it because I actually had a healthcare client. And I said, you're going to be the first investors, I'm going to be, and we're going to make this thing work. And so right there, in probably what was the worst week of their lives professionally, like we started something incredible that went on to be a success.
Interesting. So, okay. So that's how, all right. I want to come back, and that's how Pyx Health just got rolling. Okay.
Well, that's not Pyx. That was my
Oh,
first.
that's not. Oh, that was your first one. Oh, that's medical referral source.
Yes.
Okay. Before we jump into that, though, all right, let me back up just a bit here. Okay, so you grew up in middle school, Washington, D.C., high school too?
Yep.
Okay.
Yep. And I
and
went
tell
to
me about-
college in Virginia, George Mason. So all Metro DC.
Okay. Folks, tell me about your parents and any siblings real quick. Yeah, let me hear about that.
Yeah. So my mom and dad, my mom passed away 11 years ago, but she worked at the Smithsonian. She was probably one of the strongest people I've ever known and, ever probably will. And then my dad, both my parents were like very, very blue collar. My dad worked at Friendly's. And so if any of your listeners are on the East Coast, they know what Friendly's is, but the West Coast doesn't. And in fact, when I went to them, because I'm the oldest of three and the oldest cousin of 30 on one side and 28 on the other. So I big Irish family. But when I went to them and said, hey, I want to go to college, my mom literally said, well, why? Because to them, it was like, well, no, you'll just get a job like we did and you'll work it. And then I ended up going to school and had an athletic scholarship, which helped. It was a way that I could
all right.
play
That helps.
softball. Yeah.
So loans and a scholarship. That's how you got through school.
Well, scholarship, and then there wasn't very much left over, and I just paid it myself from my summer job. But that is how I got through school.
So you were a softball player in high school, athlete.
Yes, I was an athlete. I still consider myself an athlete, but I still think I move the way I used to, but I 100% do not. Like it's not the same.
Was George Mason, is that like Division I softball? What is that?
Yeah, it was Division I. It doesn't.
Wow.
It doesn't compare to like the Arizonas and the UCLAs of the world because they play year round. No, but it was good. I mean, listen, it was probably one of my most like favorite experiences in life. I still, keep up with those women on Facebook, and it was back then. The sport wasn't on ESPN. It wasn't the way it is now. So I'd like to say that we were pioneers, but what it did was it gave me a community inside of a big university and, really helped my experience.
Probably shaped you in a bunch of ways, for sure. I mean, as a recruiting firm, we always, I guess maybe it's because I drive it this way with the recruiters, but I always tell them, I'm like, look, if you see a candidate that played Division I sports through college, and by the way, worked like a part-time job on top of that and went to school, yes, I want to talk to that person because there's grit, there's determination, competitive spirit, work ethic, teamwork, coachable, people skills, all of it.
You're 100% right. I was one of the kids in the athletic housing who I actually worked for the university, and I would at night go and lock up the PE building. And so I couldn't afford just to go to school. I worked the entire time, even in season, and then on the summer waitressed, and that's where I made some money. But
were you a resident assistant RA? Were you an RA in the dorms or anything? No,
because I lived primarily in athletic housing, and it's different there. It's like there's really not RAs. You sort of you report up through the structure of your team. Like there's a team manager, et cetera.
Okay, cool. All right. And is your dad still alive today?
Yes, he is. And he just moved here, retired and came here. I really hope my dad doesn't listen to this, but he is absolutely nuts. I mean, he is just one of those people. He tells a story better than anyone in the world. But, he grew up kind of in Boston. He's in his 70s and he still wears man bling. I'm like, Dad, like, like the gold chain might have worked when you were 18, but it's not working now. So
That's pretty cool. Oh my gosh. We'll have to add in a photo of that. A photo of that
I'll
somewhere.
send you a photo. We call him Greggy J. We'll
That's
send you a Greggy
nice.
J photo.
Has he got a girlfriend? 11 years ago, your mom passed 11 years ago. Is he dating around? What's he doing?
Well, they were divorced before my mom passed,
Oh,
but
okay.
yeah, he has a wife and
Oh,
she's
I see.
great. And
Okay.
I don't know that I call her like a stepmom because I was
Yeah.
totally an adult, but she's a lovely human and very good for my dad. So
Okay.
we were happy to have them move out here.
That's nice. Okay. Well, very good. All right.
Yeah,
And
because
what?
after my mom died, my brother and my sister moved off the East Coast and came to Tucson, and we all live within 11 miles of one another.
Everybody?
Everybody.
Everybody?
Everybody.
Wow. All right. How about that? They all followed Cindy out. That's nice.
Yeah. So we have a good life. It's a nice life,
I mean, Tucson's a cool little town. What percentage of the town operates off tourism? Like 80%? I don't know.
It frankly, when I was in the marketing space in the 2005, 6, 7, 8 era, you were right. Tourism was the, but
Yes.
the university has done a very good strategic job of building like a tech community here. There's a lot more entrepreneurship, particularly in Phoenix. So there's
Okay.
more angel money being, I wouldn't say that Arizona is known for VCPE kind of, but as far as angels go, a lot of them retire here. And so it gives early stage startups a really ripe opportunity. So, and with a cool university in your backyard. So it's really, if I had to give you a percentage, I would say the percentage is maybe 55 or 60 as compared to the 80, 85 that it used to be.
Okay, very cool. Last time I was out there, I don't know, we were on a bunch of ATVs, and I remember riding dirt roads like from Tombstone. We were at Tombstone, and then we rode a bunch of other places. We went to Tombstone, went to the bars, got hammered, got back to the ATVs, drove around. I'm sure everybody that lives out there appreciates all the drunk people on ATVs driving around. I'm sure you guys love that.
It is a phenomena. Did you do the old fashioned photo where you like put on all the garb?
No, I didn't do that, but
okay.
we did. I think we stopped in every one of those bars in Tombstone. I can't remember, but yeah, it was a fun time. Okay, so you've been there for, gosh, how many years now? How long you been there?
21.
Wow, 21 years. Okay. All right. And family, yourself, partners, spouses, kids, what's your story, if you don't mind sharing?
Not at all, because it's actually a part of why I'm here with Pyx. But I have a wife, and she had 2 daughters when we met who were 11 and 10. And
Okay.
then I have a son who's 14.
Okay.
So
and they all live, and how old are her daughters now?
Well, we lost her oldest daughter, and that is the story of Pyx. When we get there, she basically suffered from bipolar and had like a super, super horrible year where she was in and out of the emergency room and ended up in an inpatient facility. And when I went and talked to her there, I said, I kind of want to understand what comes first so we can try to get ahead of this kind of episodes. And she started talking about being lonely. And at that time, this was about 2017, I'd already sold my other company, worked for them for 2 years, and I really wasn't doing a lot other than consulting, but I started researching loneliness. And in 2017, we were the only developed country in the world that didn't treat loneliness like a diagnosable, treatable condition like depression or anxiety. And so I became very passionate about it and eventually started, building a business around it. And then a couple years in, she passed away. And so it's very much at the heart of what we do here. It's her legacy. Like, my personal mission is that to help prevent families from having to go through what we went through, and really to raise the consciousness around loneliness. Now, the pandemic helped us out a lot, because every single person felt in some way, shape, or form lonely. But it really is, and I don't use this terminology. It is the next epidemic for the younger generation. 14 to 24-year-olds are significantly more lonely than seniors.
Do you blame a lot of that on social media?
Yes. And here's what I'll say. Social media in the early days did a good job of kind of uniting us. And then it became
Divisive.
right. Exactly. It is all about, I call them keyboard warriors. We all know this. I don't have to, but you can really isolate people very easily with comments from folks you don't even know.
Yep.
So the problem is, though, if you're going to solve that problem, if you're going to really get the youth to trust you and start moving them through loneliness, it has to be something that they can engage with through their phone. So we need the technology, but we want to stay away from the sort of, the environment that social media creates.
I know, right? Well, I want to talk about that more, the social media piece. How old are the children now? Your son and she has a son left. So there's two boys.
She has a daughter, and
I'm sorry.
She's 26 and is in New York and doing very well.
Great.
And then my son is 14 and he'll start high school next year.
Is he a rebel? Like at 14, that's right when they start pushing back a little bit. Is he's like straight A's, I'm in the library, or is he like, I'm sneaking out at night?
He's straight A's on the library. In fact, this is a great story to articulate, Grady. I got a tattoo when he was like 10, and I showed him the tattoo, and his comment back to me, this 10-year-old boy, was, "Mom, that is very permanent." So that is totally his personality.
Wow.
Completely different than mine. So.
Wow. Okay. How does that match? I forgot to ask you, when you were a teenager, were you in trouble, or were you at the library straight A's? How did you compare to your son?
So I did well academically, but I was defiant, right? Like I sort of, I kind of knew that I was different, like, wasn't, and grew up in an Irish Catholic family, so couldn't really be myself at the time. And so I always just had a chip on my shoulder, which turned out to serve me well in life later on. But as a teenager, it was hard. So if you look at my family and my siblings, I was the most naughty for sure.
Do you mind me asking? Yeah, super old school Irish Catholic family. Do you mind me asking when you came out with your parents? Can you tell me? I'm curious how old you were.
100%. I was 21, and the reason I came out when I was 21, remember back to being a cop, I had a salary, I owned my own house, and I was standing on my own 2 feet. And so gotcha. I was worried before that they're, they
were going to cut you off. They're going to be like, you're out of the.
I mean, my mom, who was a very faith-based woman, and, she took it hard, but I will tell you, she came around very quickly.
That's good.
She always gave me unconditional love. And in fact, started sort of, she would write letters to the bishop about how, yeah. So she ended up in life, cool. But that, frankly, because we serve a lot of the youth population across the country in foster and Medicaid population. So folks that are living below the poverty line. Mm-hmm. And one of the biggest reasons why kids have suicidal ideology is because they identify as LGBTQ, right? And we see that a lot. Mm. And so it's so crazy that my experience in 1989 is the same experience, if not worse, than these kids are having. Like, we haven't made as much progress as we think we have.
As you might think. Yeah, as you might think. All right. So Pyx Health, I want to make sure we let's get into this. It's, by the way, it's PYX, Pyx Health.
Pyx Health.
And Cindy Jordan can also be found on LinkedIn as well. And Pyx Health, the website is PYX Health, pyxhealth.com.
That's it.
Give us the overview, and then I'll hit you with some questions. Go for it.
All right. So I told you why we started it.
Yes.
And I knew that there needed to be some piece of technology. You need technology for scale and, essentially growth. But what I also knew, if you were going to treat a mental behavioral health condition for people, technology can't do it all. In fact, I was recently quoted in a story on NPR as a tech entrepreneur who says, AI will not solve our mental health problems.
I wouldn't think so. I would think it would even make it worse, because if I'm depressed and I know I'm talking to a robot, that might make me even more depressed.
Exactly.
Sorry, I didn't mean to cut you off.
No, you're right. I mean, and I wholeheartily agree with that. And so what we did is we built a bot, but he doesn't address the diagnosis or disease state. He just he's like a friend in a coffee shop. He tells jokes and he measures sentiment. And so very quickly, we start to get an idea about how the person is feeling in that moment. And the way that I explain it, Steve, is like, if you and I were meeting for coffee and you knew I suffered from depression and we sat down, the first thing you would say to me is not, hey, Cindy, how's the depression going? You'd say, how are you? How's your day going?
Right.
And that is what we miss in healthcare technology. It's like we go straight to the disease state instead of, earning some trust. So our bot is very good at getting the end user to trust them. And then we start to develop essentially a picture around how the person is doing. And when they throw the flag for being chronically lonely, or they have like some kind of social determinants of health needs. So think no food, bad housing, et cetera. Because again, the majority, we cover 4.5 million people. The majority of them are on Medicaid, so under the poverty line.
Okay.
So then my humans get involved, and I have a whole call center of folks all across the country, about 170 of them, and they're called Andy, and it stands for authentic, nurturing, dependable, your friend, Andy.
That's why it's called Andy. Okay, I see.
Yeah, and they are licensed peer support. They're overseen by a clinician, and they get on the phone and provide what I call intentional companionship. They're not just saying, hey, how are you? We have a program that we move people through so they can get out of that chronic acute phase that frankly killed my daughter and move into more of a self-management. Maybe they get into behavioral health, teletherapy or something. But the reason that Pyx solves this important need, not just around loneliness, is that we have a significant shortage of mental health providers. And so there has to be a stopgap. And what Andy serves is that stopgap. And we make over 1,000 calls a day. And
really?
Yeah, I can only think about the impact that we're having every single day. And so it's a super motivating to get up and go to work.
And the call when the patient, I guess, but do you call them patients? What do you
call them? Members.
Members. Sorry. When the members get through to the call center, that call center person then develops a lasting relationship, and then that's the same call center person I call back, or do I get somebody new every time? Is there a relationship built there?
Yes. So another reason to employ Andys and not use volunteers, there's a lot of companies that'll like volunteer a phone line, is because Andy comes to work every day. They always show up. And yes, when you are working the program through Pyx, you have the same Andy. Now, sometimes you might pick up the phone and call into our call center, and maybe your Andy isn't there, but that's a one-off thing. We try to make sure this is what's interesting. For my adult population that we serve, they make an average of 3 Andy calls. For my youth population that I serve, think 14 to 24, they make an average of 17 Andy calls.
Before they stop?
Well, sometimes they don't stop. Sometimes they'll just go more into a maintenance mode. Sometimes they'll leave and come back. Our goal isn't to make you stay on the platform for a year. Our goal is to help you get through, whatever you're dealing with in the moment, and to be here for you if you need to come back. And so
I like it. Are the calls, I'm sure you group them with like mental illness, loneliness, depression. I don't know how you probably classify them in some way. What's the largest percentage call that you get?
Well, we don't kind of break it out like that. What we'll do is we develop like a complete picture around someone, and usually it's in an acuity scale, right? So We use evidence-based screenings. We only follow science. And what that is, evidence-based screenings are the same things they ask you in a doctor's office to diagnose depression, anxiety, and loneliness. They're tried and true. So we use things like that. And then we use latent data, like what time of the day were they using it? How were they responding to Pixar's jokes? And then you start to develop an idea around the user, the member. And so either you get ranked as low acuity, mid, or high. And
That's your buckets. I see.
That informs how we interact. And if you're asking me what the majority of our users are, they're in high acuity.
High acuity. Okay. I guess what I'm getting at, I hate to ask the same question. Try to ask this differently. What percentage are classified as mentally ill versus just lonely? Do you know that?
I don't, because
Okay.
I mean, we don't separate the two. You know, a behavioral health diagnosis is not a sentence for, you know, a terrible life. A behavioral health diagnosis is something that can be managed. But what we find is loneliness tends to be a predicator for those things. So you generally, like in Riley's, you'll feel lonely before you feel highly depressed or severely anxious. And so our goal is to like kind of find these folks, particularly the kids, before they're like way off the deep end, like Riley was, and to help them, you know, avoid that.
I know you mentioned she was bipolar, I think you said.
Yeah.
My ex-wife, my first wife is bipolar, and it just crushed our relationship. I mean, it's one of the primary reasons we didn't make it, along with other stuff, but it was just so totally debilitating. I mean, she's schizophrenic now, and she probably should be committed somewhere, but my grown sons, bless their hearts, take care of her. But I know from personal experience that it is crushing. I mean, it's to have it, live with it, be around somebody with it is it's kind of hard to describe until you go through it. And I know those. I'm assuming you get a lot of those types of phone calls. How do you can't really fix that, right? You can't heal it. You can't. What's your goal there? I guess if somebody has bipolar, let's use my ex-wife as an example. If she calls, you can't fix the bipolar, right?
Right.
What's the goal? To keep her from harming herself, what's the goal?
So the goal for your wife, and then I'm going to add something else to that, would be because here is the real definition of loneliness and what it rewires in the brain. It's not the physical act of being alone. It's believing that nobody can help you and nobody understands your plight. You're just alone. So our goal with your wife would be to say, hey, we get you, your family gets you. The best way forward is to be med adherent, take your medicine, you know, work your program, like do this. That is our goal with your wife. However, Steve, who we would likely also be treating is you, because caregivers are one of the most lonely populations, right? No point. Does anyone understand what Steve went through in that marriage other than Steve? Probably not. And so talk about feeling alone, you know, so we wouldn't just help your wife. We would help your sons. We would help you. And what we would do for her is try to, again, like it is literally a brain chemical thing. We would try to move that for her to say, you are not alone. People do understand. You can manage this. We're here. Your family's here. That's the goal.
That you just touched the nerve right there, because it's interesting. I was just having dinner. My current beautiful wife, Kim, and I were just having dinner with our youngest son, Spencer. He's 28. And I asked, routinely, I'll say, how's your mom doing? Because I know they're taking care of her. And he said something to the effect of, Dad, he goes, you don't understand like how like messed up I still am from that whole childhood dealing with her and how it still affects me. Right. And so there you go. There you go. Spencer,
he said, you don't understand.
Yeah. He's like,
nobody understands. Right.
Nobody understands what mom put me through. And I'm like, yeah, he's right. Wow. Great.
And to use your son as an example, and I'm not saying he would use it, but it probably would be easier for him to confide in someone and really express what he's feeling and how hard it is.
Yep.
That is not you.
This
And
probably, oh, no doubt about it. No doubt.
That's
Yes,
why
I
Andy works.
Yeah, that's a wow, great example. Okay, very good. You said how many people? You got 100 how many call center folks?
We have about 100, I think, in like the actual Andy call center folks, like maybe 130. There's about 180 on staff total, which includes, all the other functions. We sell to health insurance payers. So my goal would be that Pyx be provided to anybody who wants to use it and their health plan pays for it, because the health plan has an incentive to do it, because what it does is it lowers healthcare costs. Because when people are chronically lonely, they utilize differently. Like they go to the ED when they don't need to, et cetera, the emergency room. So
and they harm their bodies because they drink more, they take more drugs, they all of it.
All of it.
Talk to me about your business model there. Tell me as much as you can, share. I know it's a private company. So what's the model? How do you survive and make money? Are the insurance companies your customers? Are you charging the users? Can you walk us through the business model?
Yeah. So all we do is charge insurance companies. Because this was my second company, I learned lessons from my first one. And one of them was to really get to data outcomes as fast as you can. So the first client I signed, a health insurance plan here in Arizona, I contractually obligated them to conduct an independent case study that had to be statistically valid about the efficacy of our intervention. And that changed the trajectory of the company because it came back very good. And nice. Now we were able to go to the market with like defendable data. And so that is, so I go to health plans, I show them the data. Now I have 75 health plans instead of one, and we're in almost every state. And so I say, okay, guys, this is what you can expect, not only to save, but you can see improved outcomes. Remember, I talked about medication with your wife. One of the things we do very well is get people back on their med adherence, particularly for chronic disease like diabetes and for psychotropics for behavioral health conditions. And so that's what we want. We want people, so that's how I sell. I do not pass the cost back onto the user. It's really just about the payer.
I love that. Do you have people like United Healthcare, Kaiser? Like who do you have on this?
So again, most of the business in Medicaid and Medicare, and I pretty much have a contract with every national payer, not Kaiser, but United, Centene, we're Aetna, Anthem, like they're all clients.
Very good. And all right. And then do they take the response? Who's responsible for alerting their customers about your service? Do they say, hey, by the way, we got this over here at Pyx Health, along with your own marketing? How do you make sure, like for example, I just signed up for, my wife and I just had to switch insurances. We've signed up for Kaiser. How would I even know that Pyx Health is there if you had Kaiser? Like, how would I know?
So your health plan can and does market it. But we also do direct outbound to people. So we basically can take a population because we have an algorithm, and we can run a population, and we can just based on the things that we know about finding chronically lonely people, and we can find people who are potentially lonely, and we'll reach out to them directly and say, hey, we don't say, hey, are you lonely? You want to use this? What we do is say, hey, look, we're a service provided by your health plan, and we know everybody just needs a little help along the way. And then our conversion rates are very, very high.
I totally believe they are. I'm shocked that you're not a lot. How long have you been in business?
5 years.
Okay. I'm shocked that you're not way bigger, because I would think 360 million people in the US. I don't know what the current stat is, but damn, I bet 100 million of them are lonely. I mean, seriously.
Well, it's interesting you say that, because this year in 23, we will move into the commercial space. Like we'll get out, not out, but we'll go beyond Medicaid and Medicare. I think what we did well, and this would be some like advice I have for entrepreneurs, is like,
Okay.
we stayed in our lane, very,
Good
very
job.
focused.
You
And
strike me as a very detailed, operationally driven, keep the train on
right,
time person.
we did that. And we just kept achieving and learning, hitting our numbers, growing faster. And now we're at the point, and we'll probably take a partner this year, like a
Okay.
financial partner, where we're ready to go to the broader market.
And yeah, when you say commercial, what do you mean by that? When you say enter the commercial, what do you mean? Like direct to the consumer type business? What do you mean?
Well, no, I still really want payers as a part of this, but maybe
Okay.
think about it this way. Think about self-insured employers, which are many, many in the country, meaning they foot the bills for all of their employees. Imagine if we were offered not only as a benefit to the employees, but to the employees' dependents, those youth kids that we were talking about. So you do that, you're still going through the payers, but you're getting into a broader target market.
I see. Okay. Yeah. Very good. I like that idea. You haven't taken on any cash so far?
Yeah, I did raise to get the mostly off of angels to get the business to where it is today. But for where my sales is and how much I've raised is I've raised very little to get to where I am.
Do you want to share any number? Can you tell us how much you've raised or where you're at in revenue? Do you want to share anything?
I can tell you that it is it's healthy. And we're really in a very good place to start to look at a private equity partner.
Okay. So you're not in the growth burn cash phase. Did you actually turn a profit last year?
I did not turn a profit last year, but I will turn a profit this year.
Are you paying yourself? Are you paying yourself? Are you paying
Yeah,
yourself?
yeah. Oh, yeah. I mean, listen, this is another thing I believe. I did self-fund the business with a couple other people who are friends and family for a couple years.
Okay.
But that's not sustainable, right? Like
No,
everybody
you
here
can't do
should
it
have a
forever.
paycheck. They should have benefits. They should be able to take care of their families. It's also another reason why our turnover rate is so low. When you talk about the Andes, those folks do not have access to jobs like I give them, full benefits, bonuses, every other Friday off. I have a full-time employed therapist just for the Andes.
Oh,
and so,
wow.
yeah. So
All
I
right.
believe in a good work environment. The only
really?
reason that we grew 160% last year and 250 the year before. And so
Sweet.
when you grow like that, you have to spend ahead. That's why we're not, cash flow positive by design.
Understood. But you've had enough money in the bank to survive, obviously, and you're paying yourself. Great point. I want to pause right there about, this whole, I don't know, attractive is not the right word. What's the word I'm looking for? This whole thing where entrepreneurs don't pay themselves, and that's a sign of how awesome you are, how much you care about the business. Well, 12 or 24 months because you had some savings built up, or
Right.
maybe you have a spouse or a partner that works to help bring money in. If you want to sacrifice for a year or two and you got some things to be able to do that, I think that's okay. And I did the same thing with Riderflex. My first year at Riderflex, we started a recruiting firm. I think I paid myself like 30 grand. I still remember my wife was like, yeah, I know you're having fun building this and everything, but is this like, how much longer are we going to do this?
Exactly.
What was going to be my point? Oh, my point was, yes, you can't do that forever. It's not sustainable because you won't feel good about yourself. Your partner or your spouse will start to get irritated. I mean, you got to eventually pay yourself. And if you can't, my advice would be for any entrepreneur listening, if you're not paying yourself after 24 months, you might need to reevaluate what you're doing.
Plus, Steve, I mean, here's the thing too, and the mentality is shifting, but you said it yourself. First year I started my company, you had a wife, you probably had kids. If we believe that all entrepreneurs shouldn't get paid until the payday comes in, then we're limiting who can actually be an entrepreneur.
Bingo.
When I started my first company, my kid was 1 year old. I had a mortgage. It wasn't an option not to collect a paycheck. And so if it can only be you graduated from an Ivy League university and you can live in your parents' basement, then we are going to significantly cut off the innovation that could come out of, folks like me and you with life experience matters.
Great stuff. Oh, beautiful, Cindy. Yeah, you're absolutely right. If only trust fund babies can start companies.
Exactly.
It's like, come on, man. You know. Oh yeah, great point. Okay, so the company's growing rapidly. Congratulations. Your co-founder's on the video. I saw the video of you and her talking, which is great. It's on the website. I love the website. I like the YouTube clips that are in there. What's your wife's name? I'm sorry. What's your wife's name?
Annie.
Yeah, Annie. She's the one in the video with you, right?
Yeah.
One of the
Yep.
videos. Yeah, yeah. I love the website. Love your personality, your style, hers too, and just the way it feels. It feels good. It feels authentic. It feels real. I'm trying to think of the right word. It just feels good when you look at the brand and you start to look at it and you're looking at, come on, let me watch a couple of videos. Let me read this. Let me read that. Let me check. It feels good. It feels good. It doesn't, I don't know. So much of the, I feel like I'm jaded by the pharmaceutical companies and the fake bullshit commercials I see on TV and all this stuff. And, I like what I felt when I looked at your stuff. So
Well,
my
Steve, I mean,
compliments.
you're not alone. I mean, and I talk about this all the time. I always say that Pyx has a heartbeat, and that's beyond me. Has really is a company with a heartbeat. But here's why it works. If you're going to sell anything into healthcare, you've got to follow the money, but you don't have to do that in sort of a dirty way, if you will. So what I've
Right.
learned is, yes, we provide return to our partners, but we're doing it by doing good for the world.
Which I
And
love.
the two can live together. And
Nice.
and also the people that work in healthcare. So while healthcare, I think itself is kind of like, inherently, like you said, like people are disenfranchised. Folks that choose to, get into healthcare, particularly in the Medicaid and the Medicare Advantage space, they're wonderful people who are there to make a difference. And so, all sales is human, right? And this running a staffing company, you don't get a job on your resume. You get a job if you connect with the person that you're interviewing with, period.
Thank you for summarizing every coaching moment I have with a candidate. Like,
Yes.
it's the human piece, man. Come on now. Yeah, the resume
True.
gets you the interview. The human connection gets you the job.
Yeah. And my resume would have gotten me no interviews. So, I mean, I relied completely on human connection.
I want to ask you, as we get towards the back end here, I want to ask you a couple of things. I want to go back to the social media piece. What do you think it's doing to the young people? Because you've mentioned young people, the younger, you're 14, would you say 14 to what? 14 to.
So we consider 14 to 24 to be sort of like, it is a youth demographic. So the AARP has probably done the most comprehensive studies on loneliness across the country. And that's an age group that they look at. And so, we kind of just follow that bracket. When you turn 18, you are legally an adult, but particularly in this generation, you're not an adult, right? You have no life experience. You're in some kind of transition. You asked me how I would roll out into commercial. I also really think universities are an opportunity. And here's why. The university system is not anywhere near equipped to handle the mental behavioral health crisis that is going on inside those communities. Their campus health, there's not enough providers. I don't know if you saw the news, this is probably like 6 months ago, but basically Yale, one of the best universities in the country, had a mental health policy that literally told people, their students, if you are suffering from a mental health condition, go home, get better, and then reapply, and maybe we'll let you back in. And they got hammered in the media. Like, that is not acceptable anymore. Universities are going to have to use solutions like ours that are affordable and that can help bridge the gap, but in the crisis that's facing behavioral health.
It is interesting that you mentioned, you got to use tech. They got to use their smartphone to connect with you. But I do worry. I don't know. In the holidays, my wife and I went to Missouri to see her side of the family. We rented this nice cabin, and we had a bunch of our family members there, and there were some teenagers there and stuff. And man, trying to get them to engage and put that phone down. Damn. I mean, their head is in that
Yep.
fake world, so to speak, like all the time, just all the time. And I was like, tell my wife, I'm like, no wonder some of these teenagers are feeling like they do. They look on social media, they see the beautiful girl with what they think is the perfect life, right? And why can't I look like her? How come I don't have as many friends as her? And then somebody says something mean to them. There's the whole thing, and then they're involved in that, and they're living in this meta universe. I don't want Facebook to cancel me or anything, but they're living in this fake universe, man. And I'm like, and I just feel like a lot of it's being driven by social media and living on their phones. I'm not an expert. Maybe I'm totally wrong. I don't know.
No, you're 100% right. It's documented. I don't know if you saw, but a couple weeks ago, the Seattle School District sued Facebook, Instagram, TikTok, and one other on behalf of their students for creating a mental health crisis.
Wow.
So
no, I didn't know that.
you're 100% right.
Yeah,
But here's how you solve it. Like it's the same with my kid, right? I'm not going to pry that phone out of his hands. That is the world that we live in. But while he's on it and he maybe gets a bad message on TikTok or somebody, gives him a thumbs down on something, if the icon right next to that is Pyx and you can push that button and you can interact with the bot, or you can talk to your Andy, there you go.
I like it. No, they need somebody to talk to. And you're right. They don't want to talk to their parents, right? Most 14-year-olds really don't want to talk to their parents. Not really.
Right. It's
I mean,
true.
your son probably wants to talk to you, but most 14-year-olds are like, I'm not going to have this. I'm not going to tell dad. I'm not going to tell dad that I'm lonely. He'll think I'm a sissy or whatever. I mean, he'll think bad of me, like they're not going to, you're right. They want somebody else to talk to. No, I like that.
No, my kid's just like yours. Like you would think it would be different. And like, I'll ask him all the time and, he'll say, I don't understand why we always have to talk about my feelings. And I'm like, okay, like, I totally get it. Let me ease back here a little bit. But, it's part of just going through puberty and growing up and, in that, and then compound. Imagine, I always think about my childhood. If there were social media, I don't know if I would.
Oh man. Oh, totally. I totally think about that all the time. I'm like, holy cow. Yeah, I'm glad we didn't have more than that. I'm glad that there wasn't a device on me where my parents could get a hold of me at any time.
Yeah. I remember when I was learning to drive and I was lost on the Beltway around DC. I literally had to pull over and go to a payphone to ask my mom for directions, right? And I had to know her phone number. It was not like it is now.
No doubt. No doubt about it. One more thing on the AI. I want to ask you this. I'm so glad you have the human element. Thank you. You know how many people I've had on the podcast, so many tech entrepreneurs, and I love them all. They're all great people. But every time I get somebody on the podcast and they're like, yeah, I created this new technology so that my bot can talk to your bot, and we don't even that way we don't have to have any conversations, and we'll just have robots talking to each other, and robots will do everything, and we don't have to interact with you. I'm like, I always think, that's cool. I'm happy for you because you created a tech company. But that's not the world I want to live in. I don't want to live in a world where bots talk to bots. I want to live in a world where people talk to people.
Yeah. I mean,
I love the fact that you have a tech angle with a human element that is the most important piece of what you're doing. That is so refreshing. Thank you.
Well, listen, a lot of tech entrepreneurs stay away from it because they want ridiculous margins. The truth is, I call myself a tech-enabled services company. That's what I am. I still have a very healthy margin, but have a wonderful workplace that involves people. It's all about, do I need to be in the 90% margin, or is 70 okay? And I'm providing an amazing service for people. And so it's sort of like that, what you and I are talking about as far as who entrepreneurs are. I'm 51. And so I realize that I don't need to be a bazillionaire nor do I need to have a company that I would rather spend the money in the right place and still have a healthy company that does the right thing. I am a firm believer, and this is my second tech company, that tech just can't do it alone. End of story. It doesn't really
Agreed.
kind of matter what the situation is.
Totally agree. Isn't it interesting that after you turn 50, I talk to so many people, I'm 55. After you turn 50, you kind of come into this space where you're like, as long as I'm making a decent amount of money and I got food, water, shelter, and hobbies and love, I mean, I'm good. Like, I don't need to be a billionaire and have a yacht. Like, I'm still going to like take a shower, eat dinner, and go to bed and visit with my wife, just like I would in my regular house.
Yeah. I mean, money doesn't make you happy. It makes things easier. It gives you access, but it doesn't make you happy. Like I always say, in your 20s and 30s, particularly as a woman, you go through this self-doubt stuff. I think Brene Brown calls it imposter syndrome. Like, then when you get to your 40s and your 50s, you're basically like, screw it. Like, I don't need anyone's approval. I am who I am. I believe in
who I am. Yeah.
Like, I'm going to actually believe in me, and that was what I crossed over when I got to like, I'm going to believe in me. I didn't start my first company until I was 39.
Did that exit? Did you have like a big time exit there? A small exit? What happened?
It was relatively small and very fast. I only raised about $1 million in angel money. It was a great company.
You raised $1 million. Yeah, that's not a small feat. I mean, come on.
No, then it wasn't. In fact, a funny story is like, I almost got divorced because I would talk about that company at every barbecue, at every family outing until I had enough money to actually launch it. But what happened was it integrated into electronic medical records, which back then was a very huge lift. And so I either was going to have to take on a lot of money, which I wasn't interested in doing at the time, or find a strategic partner to sell it to. So we did that. We sold it to a strategic partner. I worked with them for a couple years. It was great. But I knew early on in Pyx, I knew that it was going to be a lot bigger. Like, you could just tell from like the first, it was not going to go the route of that first company.
PYX Health, pyxhealth.com, Cindy Jordan, ex-DC cop, now a full-blown entrepreneur, living in Arizona on her second company. Congratulations.
Thank you. Thank you for having me.
Yeah, you bet. Thank you for being on the show and sharing your story.